Hello. Anybody there?
Can you hear me clearly?
Yes.
Oh, okay. Hi. We are group 4. Today we will talk about lab test, and our group includes Thúy Hằng, Hà My, and me, Mỹ Nam. Now I will start right now. First, we will go about the overview. Laboratory test check a sample of your blood, urine, or body tissue. A technician or a doctor will analyze your results, analyze the test results to see if your results fall if your results fall within the normal range. So the test have a range because there are some difference between between person to person. So there are many factors. You can see this is a typical picture of blood test. Next, we will go about the factors affect test results. These include your sex, age, and race. About the race, it can be example by between the black versus the Caucasian. Next is what you eat and drink, medicines you take, and how well you followed the pre-test instruction. So beside these factors, there are some subjective factors like smoking, exercises, or you have stress, pregnancies, and some objective factors like specimen storage conditions can affect the results too. So your doctor sometimes will your doctor may compare your results to results from the previous test, and the laboratory tests are often a part of a routine checkup to look for changes in your health. They also help the doctor to diagnose medical conditions, plan or evaluate treatments, and monitor disease. Next, we will go about laboratory testing cycle. So this lab testing cycle consists of 3 phases: pre-analytic, analytic, and post-analytic. About the pre-analytical phase, this is for test ordering, specimen collection, transport, and processing. About the analytical phase, this is for testing. So in this period, the technicians or the doctors will look the specimen under the microscope to see if there is anything wrong in your blood or your urine. Sorry, and the last is post-analytical phase. So in this phase, will be for the results transmission, interpretation, follow up, and retest for the exact results. So in addition, while phases of lab testing cycle, the errors can occur but most frequently is widely analytical for 62%, although 75.6% of all sorts of laboratory tests had no effect on the patient outcome. Approximately 25% had the negative impact. So next, I will go to the some questions usually will be asked before ordering a laboratory test. Is why is the test being ordered? What are the consequences of not ordering the test? How good is the test in discriminating between health versus disease? And how are the test results interpreted? And the last is how will the test results influence patient management and outcome? So explaining about this question for the patient is very important because it will affect their decision and help them make the right choice. And I want to tell you a fact that no text is perfect. So some up tests are pretty much useless. But good tests will sometimes provide inaccurate results. Some tests tend to have more false positive results and others tend to errors on the side of the false negative. So I told you some information about the lab test, and now Hằng and me will go deeper by talking about the reason why we should ordering the lab test and some common lab tests.
Hey guys, you guys just have here. I'm sorry. I turn my camera. Hello. You guys just hear about some factor affect the lab test, as well as some knowledge about the laboratory test cycle. So why we must have a lab test? What is the effect of lab testing? I will show you four main reason. First is
Wait a minute. I'm sorry to interrupt, but are you sitting in front of a fan?
okay. It's better.
Yeah.
It's a little hot now, so should I continue?
Sure.
The first reason is diagnosis. Exactly to run in or run out a diagnosis. To select a proper diagnosis, it's recommended that most specific tests is used to confirm a diagnosis that's running, and the most sensitive tests be used to establish that a disease is unlikely that's run out. Maybe it's more difficult to understand, but it's just mean a check test result have I'm sorry have the doctor to confirm his diagnosis of your disease. Then let you do another test to get exactly result. For example, you had a fever for 5 days. Then you went to the hospital and ordered a blood test. Your platelets decrease into 72. The doctor will diagnose you with dengue. After that, you will have a dengue NS1 antigen test to confirm his diagnosis.
Confirm.
Oh, sorry, confirm. The second reason is monitoring. Through indicator and picture, doctor can closely monitor the situation, drug compatibility, speed of recovery of patients. From that, developing an appropriate treatment regimen for the patient. The third is screen. Screen is a strategy conducted in a population to determine the presence of an undiagnosed disease in individual without signs or symptoms, thus allowing for early intervention and management in the hope of reducing mortality and morbidity. And finally, research. Research based on clinical diagnosis results help scientists find cures for new disease, as well as improve the old one, thereby saving costs, time, and enhancement life quality for people. We will continue with another part of our seminar. Common type of lab tests. Now I will show you a really common lab common test. That is urinalysis. Sorry, urinalysis test. Oh, I got a bit nervous. A urinalysis test is a test of your urine. That's used to detect and manage a wide range of disorder, such as urinary tract infection, kidney disease, and diabetes. You all know diabetes, right? A urinalysis involves checking the appearance, concentration, and content of urine. Abnormal urinalysis results may point to disease or illness. For example, a urinary tract infection can make urine look cloudy instead of clear. Increased level of protein in urine can be a sign of a kidney disease. Unusual urinalysis results often require more testing to uncover the source of the problem. Urinalysis is common test that done for several reasons. The first reason is to check your overall health. And next reason is to diagnose a medical condition. A urinalysis may help diagnose the cause of the symptoms that you experiencing, like pain, blood in your urine. The final reason is to monitor a medical condition. If you've been diagnosed with a medical condition such as kidney disease or a urinary tract disease, your doctor may recommend a urinalysis on a regular basis to monitor your condition and treatment. So what should we do to prepare for the test? Before test, you can eat or drink normally, and remember, tell your doctor if you have any medication, vitamin, or other supplement. To get the more accurate result, the sample may need to be collected midstream using a clean catch method. This method involves the following steps. First, clean the urinary opening. Women should spread their labia and clean from front to back. And men should wipe the tip of their penis. After that, begin to urinate into the toilet. Then pass the collection container into the urine stream. Take at least from 30 to 60 millimeter urine into the container, then finish and deliver the sample as directly by your doctor. If you can deliver the sample to the designated area within 60 minutes of collection, just the sample, refrigerate refrigerate the sample unless you've been instructed otherwise by your doctor. Your urine sample is evaluated in 3 ways: visual exam, dipstick test, and microscopic exam. Visual exam is examining the urine appearance. Urine is typically clear, cloudiness, or an unusual may indicate a problem, such as an infection. A dipstick test check for pH level, concentration, protein, sugar, blood, and the microscopic checks for some factor such as white or red blood cells, bacterials, and crystals. Then your doctor may evaluate the urinalysis result along with those of other tests or other additional tests to determine next step. I'm done my work. Next is Hamilton.
Hello, everybody. Today I will present about the common lab test, and but my presentation only about blood tests. Nextly, the first is the complete blood count (CBC). A complete blood count, or CBC, is an easy and very common test that screens for certain disorders that can affect your health. A CBC determines if there are any increase or decrease in your blood cell count. Normal value vary depending on your age and your gender. Your lab report will tell you the normal value range for your age and gender. A CBC can help diagnose a broad range of conditions, from anemia and infection to cancer. Measuring changes in your blood cell level can help the doctor evaluate your overall health and detect disorder. The test measures the 3 basic types of blood cell. The first is red blood cell. The CBC measures 2 components of your red blood cells, hemoglobin and hematocrit. You must remember that low levels of hemoglobin and hematocrit are often sign of anemia, a condition that occurs when blood is deficient in iron. The second is white blood cell. Any abnormal increase or decrease in the number of types of white blood cell could be a sign of infections, inflammation, or cancer. The third is platelets. Any changes in platelet levels can put you at risk for excessive bleeding, and can be a serious medical condition. Doctor may order CBC as part of routine checkup or if a patient has unexplained symptoms such as bleeding or brushing. The CBC can help the doctor do the following: evaluate patient's overall health, diagnose a health problem, monitor a health problem, and monitor your treatment. And you can look at the screen. In the screen is normal range of CBC test. And lastly, the second test I will talk today is serum iron test. The main aim of the iron serum test is to examine the iron present in the blood. Iron is a significant component of the blood. It is the iron that carries the oxygen from the lungs to other parts of the body. Excess of iron or deficiencies of it will have unhealthy oxygen carrying reflex cell practice. Doctor order for an iron serum test if there is an abnormal result in CBC test that I told you before, showing the decreasing hemoglobin or hematocrit level. Then doctor may also prescribe for the test if the patient complains of fatigue, dizziness, weakness, headache, failure, shortness of breath, chest pain, waist pain, and every reason of which could be the deficiencies of iron. Children are often seen eat chalk, clay, dirt, or licorice. This indicates that iron is deficient.
Cháu Minh cắt ngang một xíu. Cháu Minh hỏi mấy bạn khác ở trong lớp ấy, có nghe bạn Mỹ nói rõ không?
Dạ nhỏ hơn so với bạn Hằng.
Hả?
Nhỏ hơn so với bạn Hằng.
Mình không nói về cái độ to nhỏ mà ở đây mình nói về cái độ rõ của âm ấy.
Dạ không rõ lắm.
Mấy bạn khác thì sao?
Dạ con cảm thấy như không rõ.
Em cầm cái loa đó em nói gần gần xem thử.
Dạ, cô nghe được không ạ?
Rồi cứ thử tiếp nha.
Yeah. Now I will continue my presentation. The test enable the doctor to know more about iron deficiencies present in the patient, diagnosis of hemochromatosis, or to monitor a patient with chronic illness. Before as in treatment for hemolytic anemia or sideroblastic anemia, and the final to track if there has been a case of iron poisoning. In the screen is also the normal range of serum iron test I show you. So lastly, the third test I will presentation is liver function test. Liver function tests are blood tests used to help diagnosis and monitor liver disease or damage. The test measure the level of certain enzyme and protein in your blood. Some of these tests measure how well the liver is performing its normal function of producing protein and cleaning bilirubin, a blood waste product. Other liver function tests measure enzymes that liver cells release in response to damage or disease. But you must remember one thing. Abnormal liver function test results don't always indicate liver disease. Liver function tests can be used to screen for liver infections such as hepatitis or monitor progressions of a disease such as viral or alcoholic hepatitis. And determine how well a treatment is working. Excuse me. Measure the severity of a disease, particularly screening of the liver, and final is monitor possible side effects of medication.
Is
You-
there anything on the screen, please?
And some common liver function tests include alanine transminase or ALT, aspartate transminase, AST, and oncolyne phosphate, ALP, albumin, and total protein, bilirubin, or gamma glutamine transferase.